Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care, so that you can have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers, and the question last week was part 6 of My Aunty is in intensive care on Ecmo for ARDS. We're very worried she may die. Help. You can check out the answer to last week's question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another question from one of our readers, and the question this week is part 7 of My Aunty is in intensive care on Ecmo for ARDS. We're very worried she may die. Help. Part 7. So, Lee from the UK writes again. Hi Patrick, we've been back to the hospital today. My auntie is still stable on oxygen levels 35 to 40%. The arterial blood gases are still okay. The dialysis machine was off today because of the end of the cycle. They're putting it back on later today. They were also taking some samples in the last few days, and there was an indication of infection in the dialysis line from the dialysis machine. So they're putting new lines in as well. They've also taken blood samples to see if there's something underlying that has been either not detected or has gone missing. If the lungs have been damaged during high oxygen level blasts my auntie required at first, and this is what's causing the lungs to keep holding fluids or to be leaking fluids, can this be rectified? Would this have been detected by now? Would we have been informed of this? Also, would lung damage to the walls of the lung be able to be seen by X-ray or by camera? Can they open my auntie up to find the problem, and can this be reversed? We have not spoken to the Ecmo team at the minute because we feel we've come away from that a little for the time being, and we will speak to them soon. I have spoken to the Ecmo team from London to query whether a patient can have a second blast after 7 days on Ecmo, and they confirmed this can be done in some cases. Also, low platelet count is not a problem, although I'm sure my auntie's reading last week was 90 and today it was 140. Her white blood cells are not too low either and are not of concern. It seems the sole concern is clearly the fluids getting back into the lungs, and we really want to know why. Thank you very much, Lee. Hi Lee, I think judging by your last couple of emails that your auntie is definitely improving. If she's now on 35 to 40% oxygen requirements and if her blood gases are good, that's very encouraging. Again, oxygen requirements above 65% and high carbon dioxide levels are an indication for Ecmo. Getting a line infection from either a central line or a vascular catheter, which is used for dialysis, is nothing unusual, and as long as they have identified it and are changing the lines and screen the old lines, it sounds to me like they're doing the right thing there. It would most likely be difficult to ascertain why the lungs still keep holding fluids. It's part of having ARDS. However, her relatively low oxygen requirements indicate that she's definitely stabilizing. The damage of the walls in the lungs can most likely be detected by doing a bronchoscopy. However, this is an unnecessary risk at this stage, I would think, and once again, I can only emphasize that things move extremely slowly in intensive care when critically ill. The last couple of days with the oxygen requirements and the blood gases being stable show slow progress, however. Take this as a very positive sign. Your auntie might be plateauing for a while before she's making progress again. If your aunt's lungs are going to fully recover, it will be over time and not in an instant. It won't be like switching on a light switch, and it's more like switching on a light with a dimmer. To open her up would be a big risk, and ARDS or pneumonia or lung failure is always treated conservatively, meaning that surgery is not really an option. Therefore, you need to give it time. Be patient, things don't happen quickly in ICU with ARDS. If you have read Ellie's question, you would have seen that her mother was in ICU for many weeks. I think it was 3 months in total. Find the link to Ellie's question on the link below this video, in the written version of this blog on our website. As I have hinted towards yesterday, Lee, you might as well be at the beginning of a long journey. Given that your aunt's white cell count is down and given that platelets are back to normal, that's encouraging as well. There are no quick fixes in ARDS, and sorry that I keep repeating myself here, you need to be patient and you need to give it time. I know that's easier said than done, but it's the only option. Your auntie is not going backwards. 30 to 40% oxygen requirements is pretty good in ARDS, and if the lungs recover, the fluids in the lungs will take care of themselves. They've got to keep on the dialysis machine, and if the sole concern is the fluids on the lungs, then that in a sense is encouraging because your aunt is not battling anything else. A big challenge in ARDS can be if other organs are failing too. Given that's not the case from what you've described, give your aunt the time to let her lungs heal. No matter how much we all want to speed up the recovery of a critically ill patient in intensive care, they take their own time, and your aunt will recover in her own time. Make sure she gets good nursing care as well. Things like regular washes, regular turns, and regular mouth care can do wonders as well. Make sure you stay well informed as you have been all the way along. Stay strong and patient and keep doing what you're doing. Small steps, and often 2 steps forward and 1 step back. Let me know how things go. So, how can you have peace of mind, control, power and influence whilst your loved one is critically ill in intensive care? You get to that all-important feeling of peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to peace of mind, control, power and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insights so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered and I'll see you again in another update next week. Make sure you also check out our blog section for more tips and strategies, or send me an email to support@intensivcarehotline.com with your questions. Also check out our product section, where you get more ebooks, videos and audio recordings, and where you can also get one-on-one consulting with me over the phone or via Skype. This is Patrick Hutzel from intensivcarehotline.com, and I'll see you again next week in another update.